Hey everybody, welcome back to my channel. Today I am going to be diving into sunrise therapy or dawn simulation or sunrise alarm clocks, everything kind of in one. My name is Autumn Martin. If you're new to my channel, I am a certified physician assistant currently practicing in outpatient sleep and pulmonology medicine. Today I'm going to be talking about what type of disorders I recommend the dawn simulation or sunrise alarm clocks for. Obviously, a lot of times these therapies are used in conjunction with other types of therapies, medications, or other treatments. So, this is going to be more of a broad overview. But you are tired, you are busy, you are distracted. And a lot of times it's hard to get into a provider, to get in to see someone, and at least start the process of getting some of these problems taken care of, especially when it comes to your sleep, which is so important. So today I'm going to be breaking down just a few of the more common conditions that I see in clinic where I recommend trialing dawn simulation to start the treatment process. Again, this isn't always the end all be all, but sometimes dawn simulation or sunrise alarm clocks can help with these types of conditions. So let's get started. The first condition that I see the most commonly in my clinic is insomnia. Insomnia is not only a problem of falling asleep, but sometimes it's a problem of staying asleep. And most of my patients, or even you've dealt with this, do not feel well rested. You constantly feel like you are unable to fall asleep, stay asleep, and you don't feel great the next day. Most cases of insomnia can be related to things like sleep hygiene, caffeine or alcohol intake, underlying other medical conditions, lack of exercise, chronic illness, and even certain medications. So, sunrise simulation, dawn or light therapy, and even the sunrise alarm clocks aren't always the direct treatment for insomnia. However, using dawn simulation, light therapy, or a sunrise alarm clock can sometimes help with insomnia because it does promote improved sleep hygiene and improves a more restorative wakefulness, so you're not being shocked awake. And it also is a first step to improving good sleep habits by setting a consistent alarm clock so you are getting up at the same time every morning. So, again, insomnia is usually treated in more of a whole health manner, so addressing the underlying cause, potentially having to talk to a therapist or a sleep specialist to identify if there's something else going on. And sunrise dawn simulation isn't always the end all be all for treatment, but it is a good step in the right direction to helping treating insomnia. The second one that I'm seeing a lot of right now, because we are in February in Idaho, where it's cold, where it's dark, where people are not getting a lot of sun, is seasonal affective disorder. This is usually referred to as seasonal depression, winter blues, SAD, but it is seasonal affective disorder. Now, seasonal affective disorder is a phenomenon that occurs during the winter months, usually October through February, where you get an increase of depression, low motivation, poor sleep, all of the symptoms that tend to be related with depression, except for it's seasonal. So it only tends to occur in the winter months when it is darker outside, when it is colder, and when you're not getting as much light therapy. Now, for seasonal affective disorder or seasonal depression, light therapy is the first line treatment. So there have been studies between light therapy, which is like a light box, and then also dawn simulators like a sunrise alarm clock, and they have both been shown to improve the symptoms of seasonal affective disorder. As of right now, we tend to think that these types of light therapies help with seasonal affective disorder because it mimics the sunlight coming up. When morning sunlight hits the back of your eyes, the regulation of melatonin goes down and the regulation of serotonin goes up. So your sleepy hormone levels are coming down when you're hit with morning sunrise, and your happy levels or your serotonin levels tend to get a boost. In the winter months, for most people who wake up before the sunrise and come home when the sun has already set, you're not getting a lot of light therapy. And so the sunrise alarm clock or early morning light therapy tends to be beneficial in a lot of studies for seasonal affective disorder. The third type of disorder that I see a lot of in my clinic is shift work sleep disorder. So, if you're someone who works like a night shift, so you're a nurse or you work in an industry where it's expected that you work maybe 7 p.m. to 7 a.m., your sleep is going to be disrupted because naturally our body's circadian rhythm wants us to go to sleep when the dawn sets, when it's dark, and wake up when the light comes up. For shift workers, this is impossible. You're working in the dark and then trying to sleep when it's light outside. And so this can really disrupt your circadian rhythm or your internal clock. This can be super disruptive for a lot of people, and it can really mess with their sleep, causing all kinds of other cascading health issues down the line. The reason why the sunrise alarm clock or dawn simulation has been shown to be helpful is it actually helps mimic the rise of the sun and setting of the sun. And so if you're using a sunrise alarm clock, you want to use it like you would mimic sunlight. So you want to turn it on when you're getting up and getting ready to go to work for the night. And then when you get off work of that late shift, so you might be getting off at 6 or 7 a.m. when the sun is actually starting to come up, you want to limit bright light exposure. So put on sunglasses, have darkening shades, make sure your room is nice and dark, because you want to help kind of reset your circadian rhythm to mimic your work schedule. So for my shift work sleep disorder patients, this is the type of therapy I can recommend. Obviously, again, this is not the end all be all. There are medications and other therapies for shift work sleep disorder patients and for people who work shift work. However, dawn simulation and light therapy has been proven to be beneficial in these cases, which is great because it's usually pretty easy to do, easy to implement. And if you do it consistently, studies show it works. Finally, the last one that I see commonly in my clinic are circadian rhythm disorders, or delayed sleep phase disorder. This is a problem with your body's internal clock, so you often have difficulty falling asleep and waking up at conventional times. This could be that you're sleepy at 2 or 3 p.m. in the middle of the day, and then you're wide awake at 1 or 2 a.m., unable to fall asleep. The reason why a sunrise alarm clock is thought to help with these types of circadian rhythm disorders or even delayed sleep phase disorders is because, again, when you are setting a bedtime and setting a wake time and condensing your sleep into a set amount of time, one, we think you are going to get more restorative sleep. And two, it again helps kind of reset your circadian rhythm because our body's natural response to morning sunlight is to downregulate melatonin and increase serotonin. And so when you are using something like either early morning sunlight, dawn simulation, or early morning light therapy, you're trying to reset that circadian rhythm or your body's internal clock to actually match a schedule that works for you and is going to make you feel better. Now, you don't have to have a sleep disorder to try dawn simulation, morning light therapy, or a sunrise alarm clock. People who just want to improve their sleep hygiene, maybe wake up feeling a little bit more refreshed, not have that loud blaring cell phone going off at 5:30 a.m., jolting you from a great dream to sudden awakeness. If you just want to improve your sleep habits or your sleep hygiene, you can totally use a sunrise alarm clock or dawn simulation or early morning light therapy. There are benefits that have been shown for just normal day-to-day people who want to improve their sleep hygiene. If you watch one of my other videos, I did a 10-day trial of actually using a sunrise alarm clock and was extremely surprised how much better I felt and how much better my husband felt getting up in the morning. Some of the other ways that I've seen a sunrise alarm clock used for are things like jet lag. So if you're going to be traveling internationally and your circadian rhythm or your body's internal clock is going to be completely out of whack, sometimes patients use early morning light therapy or a dawn simulation to try and get them back on track when they're traveling longer distances or crossing time zones. I've also seen it used in kids and teenagers who also struggle to kind of have that set sleep schedule. But overall, dawn simulation and morning light therapy, if you can get it by the sun, that is fantastic. That is 100% what I recommend. But if you're someone like me who wakes up before the sunrise, goes to work before there's sunshine in the sky, and isn't getting a lot of morning light therapy, this is something that you might want to consider trying. But if you're having other underlying health conditions, always talk to your own doctor, always talk to your own provider, and seek help if this isn't helpful and you're still having sleep disorders, because sleep is so important for your health overall. So if you found this content helpful, please give it a thumbs up. If you want to see more of my channel and more videos like this, please subscribe. I hope you have a restorative and great night's sleep. Thank you so much for joining me.